കട്ടാവും.
ഗുഡ് മോർണിംഗ്. എന്താ പേര്? ഷാരി. കഴിക്കാറില്ല.
അമൽ അമൽ അമൽ
ദോശമാണ്. സ്മാർട്ട് ബോർഡ് ഓൺലൈൻ സ്മാർട്ട് ബോർഡ് 2-4 ഓർഡർ ചെയ്തു. കേൾക്കാൻ പറ്റും.
ഓഡിയോ ഓക്കെ അല്ലേ?
ഞാൻ ആദ്യം ഫേസ് വൈപ്പ് ചെയ്ത് ക്ലീൻ ചെയ്യും. പിന്നെ പ്ലാന്റ് ഉപയോഗിക്കും. അത് എടുക്കുന്നതിൻ്റെ ആ ഒരു ലെവലിൽ ബുദ്ധിമുട്ട് പ്രവേശിച്ചത്. ലൈനൊക്കെയുണ്ടോ? സലൈന് വെച്ചിട്ടുണ്ടോ? എനിക്ക് അല്ലാണ്ട് സമാധാനം റിലാക്സ്. നാട്ടിലേക്ക് കഴിഞ്ഞ
ഞാൻ
ഇനിയിപ്പോൾ കുഴപ്പമില്ല. എല്ലാം ഓഡിയോ ഉണ്ടോ?
Yes, sir.
Good morning, everybody. I hope that I am audible. So that I used betadine to wipe his face. You saw I started off from the lip and slowly in circular movements I went outside. You shouldn't start up outside and then come in. Okay. Ideally you need to have a swab holder. Have two pairs of swab holders. One for the extraoral and the other for the intraoral process. And once you have used the extraoral process along with the swab holder and the gauze, you need to discard it. Don't bring that to the sterile table. Okay. Now here I have used the artery forceps for that. You people should include a swab holder or two pairs of swab holders in your armamentarium. Instruments in my way. മരവിപ്പിക്കാൻ പോകാം. ചെറിയൊരു കൂട്ടുണ്ടാവും. ഞാനിതുള്ള the anterior tooth. So I am going ahead with I'm going to give a subperiosteal injection. The bevel of the needle should hit the bone. The LA should be deposited beneath the periosteum. It's painful, so be very slow. വലിയ ബുദ്ധിമുട്ടില്ലല്ലോ. Be very slow as you deposit the solution. There's no hurry. ഇങ്ങനെ പല്ല് പോയി കൈ തരാം. പല്ല് എങ്ങനെയാ പോയി?
ഇങ്ങനെ ഒന്ന് കടിച്ചപ്പോൾ മുമ്പേ അറിഞ്ഞു പിന്നെ ഇവിടെ വന്ന് അത് പറിക്കുക മുമ്പേ പുറത്തുണ്ടായി പല കടിച്ചടിക്കുമ്പോൾ എത്തിക്കും അടി
So he had a fractured tooth. So when one particular tooth fractures, particularly in the anterior region, I go searching for the reason. And you will see a typical reason here, where you see the alignment of his lower tooth, lower teeth. Can you see this particular incisor? Kadichama? See the way this is standing? This particular tooth, it is rotated. You see the amount of attrition in these two teeth? Okay. So it may be a trauma or even otherwise as to that he is telling us when he actually was biting, as he chewed onto the tooth fractured. So So anyway, we have abundant bone in this particular case, and it's a great case to start out. But being the anterior tooth, I need to be cautious as to where the implant is coming. I would prefer screw retain respiration here, and if possible I'll be placing it in a favorable manner. നീ ഞാൻ ചെയ്യുന്നതെല്ലാം അറിയാം കേട്ടോ, പക്ഷെ വേദന ഉണ്ടാവില്ല കേട്ടോ. His periodontal condition is not very great. He needs to have his scaling done. ഇങ്ങനെയാണോ സാധാരണ കടിക്കുന്നത്? അണപ്പല്ല് ഇങ്ങനെയാണല്ലോ അല്ലേ? പല്ല് കടിച്ചുകൊണ്ട് പതുക്കെ മുമ്പോട്ട് കൊണ്ടുവന്ന് പതുക്കെ മുമ്പോട്ട് ചേർത്ത് വെച്ചുകൊണ്ട് പതുക്കെ താഴത്തെ താടിയിൽ മുമ്പോട്ട് കൊണ്ടുവന്ന് ഒരുപാട് അമർത്തി കടിക്കണം. പതുക്കെ മുമ്പോട്ട് കൊണ്ടുവരും. വെരി ഗുഡ്. മുമ്പോട്ട് കൊണ്ടുവരും. See, as he is bringing his mandible forward, see the position of this tooth. You may have to take it from top. കുറച്ചുകൂടെ മുമ്പോട്ട് കൊണ്ടുവരും. അണപ്പല്ല് കടിച്ച് പതുക്കെ മുമ്പോട്ട് കൊണ്ടുവരും. You see, so this fellow is the culprit for the fracture or loss of this tooth. See the position of that tooth. So whenever you encounter a fracture on an upper tooth, you should see as to why it happened. Because the challenge in space, the challenge posed by this tooth remains, even for the implant. So as you are fabricating the crown, you should be cautious and careful about that. Right? മുന്നോട്ട് ചെയ്യല്ലേ സൗകര്യം for you to shoot. I always make sure that the patient has undergone scaling much before I attempt at implant placement. I don't like to have calculus around in the adjoining tooth. So while I elevate the flap, I have the gauze with me. But once the flap is elevated and I am doing the implant osteotomy, I will keep the gauze away. You need to do a clean razor flap. You don't want to have the periosteum sticking there. That's what makes it painful. It should be a full thickness flap. And when you do that, you have minimal bleeding. See that? Welcome. Okay. I'm just feeling the anatomy. Yeah. Because what we see in the CBCT section and how you orient that in the mouth are two different things. Okay. I spoke about the cemento-enamel junction. That is the cemento-enamel junction. That is the zenith of the cemento-enamel junction. So I would like to have the crest of the implant at least 2 to 3 millimeters above the zenith of the cemento-enamel junction. So let's start. The wiring in a doctor അറിയാനൊന്നുമില്ല എന്തെങ്കിലും ബുദ്ധിമുട്ടുണ്ടെങ്കിൽ കൈ പൊക്കിയാൽ മതി ഞാൻ അപ്പം നിർത്തും കേട്ടോ സമാധാനമായിട്ടുള്ളത്. I'm not having any gauze in my hand. See, if your bone is angulated and if you're going with an angle, the drill can go like this. This tip of the drill should be in alignment with the incisal tips of the adjoint teeth. Okay? That is for angulated abutment for your cement retained prosthesis. If you're looking at a screw retained prosthesis, you would like to go in a more palatal direction relatively straighter. See, I go ahead with what is known as pumping action. Just pumping action. I'm looking at 11.5 millimeters. I've gone till 13 millimeters because I wish to have the crest of the implant about 2 to 3 millimeters above the cemento enamel junction of the adjoining teeth. RBT. Level out. See, my drill is running as I enter. Pumping action. What you're seeing is pumping action. Now that I have used the pilot drill, I want to see the direction of my osteotomy. നല്ലോണം പറഞ്ഞു. 'Going more towards the central incisor, I can correct the angulation with my next drill. So my next drill is 2.4 by 2.8. See, I am not holding any gauze in my hand. I am repeatedly telling this because this is a habit of many people who do, and they have gauze in their hand even as they place the implant. You don't want the fibers entangled in the implant. See, my drill is running even before it touches the bone. See, I don't have any resistance at all. The 3.75 ఉండమ్మా 11.5 కదా ఓకే I've gone till 3.2 into 3.65. The bone is relatively soft. Once the implant is dropped, I'm actually going to go ahead using the handpiece, the physio dispenser itself, to place the implant. See, I am taking the implant from the vial. Make sure that it is stable. Be very careful. So that is at 45 newtons, it is stopped there. I'll use a manual wrench to insert it further. I'm taking the torque to 50 newtons because using the physio dispenser, I've achieved a 45 newton. बात हो रही है ना? The flat surface has to be buccally placed. I can see the flat surface here. I can see the flat surface in this extension. It has to be always labially placed. Okay, so let us take a radiograph. ഇവിടുന്ന് എടുക്കണം. I think I can go another millimeter inside. See the way I am applying pressure with this finger, slowly rotating it, no hurry. Only quarter turn, don't take it like this. You see the implant? The implant is completely within the palatal and the labial cortex. Okay. Fine. I placed it a little subcrustal. I wanted it to be about 2-3 millimeters above the height of the cemento enamel junction. ഒരു എക്സ്റേ കൂടെ എടുക്കാം. ഇതോടെ നേരത്തെ വെച്ചാൽ ഇതിനെ ചെയ്യണ്ട. ഇത് യു എടുക്കണം. Now that we are happy with the placement of the implant, I am going to place a cover screw. The vial comes with the implant and the cover screw. The cover screw is supposed to be tilted like this and then removed. Make sure it doesn't fall. This is a thumb screw, so you can keep your finger here, stabilize it as you rotate the screwdriver. Do not tighten it too much. Do not use a torque wrench to tighten the screw. The cover screw should be placed passively. Otherwise it can get cold welded. Next time when you remove it may not come out. Okay. So that's how it looks after the cover screw has been placed. Hello.
Yes, sir.
Okay. So now we'll place the sutures. ബുദ്ധിമുട്ട് വല്ലതും ഉണ്ടായോ? ഇല്ലല്ലോ. വേനയുണ്ടോ? സിസ്റ്റേഴ്സ് കൊടുക്കാൻ പറ്റും. മക്കളെ ഇത് വാങ്ങിച്ച സിസ്റ്റേഴ്സ് നിൽക്കേ വേനയുണ്ടോ? ശരി വാക്ക്
ഒരു ലെങ്ത് വെച്ചിട്ട് കട്ട് ചെയ്യാം.
3 millimeters. കഴിഞ്ഞു കേട്ടോ. Give him amongst metrodus also. And after about a week you can have his teeth clean. ഒരാഴ്ച കഴിഞ്ഞിട്ട് ഒരാഴ്ച കഴിഞ്ഞിട്ട് സ്കീലിംഗ് ചെയ്യുന്നത്.